Global Fund, a development partner aiding over 100 countries globally, and in Uganda specifically with the fight against 3 diseases, HIV/AIDS, malaria and tuberculosis, is racing ahead of time to raise $14 billion for another 3-year period starting 2021.
So that will be a 15% increase at least if we reach the 14 billion at least resources objective.
Recipient countries like Uganda in the 2018-20 period received $500 million from Global Fund. Countries are required to provide counterpart funding to receive the funds.
This is needed if we want all together to fight efficiently and at the right scale against HIV, malaria and tuberculosis. And so in our statistics what we can see is that if the mobilization is at the right level, the recipient countries can dedicate up to $46 billion to the fight against the 3 diseases.
The Ministry of Health is however stretched by a long list of needs and priorities.
A lot of resources are going into these program areas, but forgetting that the majority of the population are suffering from other diseases. If we look at the prevalence of HIV, it is currently about 6.1% of the population.
This forms part of the reason government is pushing hard to have a health insurance scheme in place, with a bill presently under scrutiny by Parliament.
So another one falls sick, another one falls sick. By the time a year ends, there are more people who have saved more money into that insurance scheme than the people who fall sick. So even now, the fund will even begin to develop, to grow.
Experts from the health sector meeting in Kampala under the auspices of Global Fund were deliberating on alternative innovative ways countries can fund and sustain health budgets. Jackson Onyango, NTV Tonight.